URAC, the Utilization Review Accreditation Committee, accredits specialty pharmacies today. Is that mandatory at this point for specialty pharmacy, Cheryl?
You know, it's not mandatory, but what we see is for a specialty pharmacy to be able to participate in certain payer networks, also to be able to submit on certain pharmaceutical manufacturers' requests for proposals and pricing. Questioning around which accreditations the specialty pharmacy holds is there, and it's used as a qualifier and determinant.
Very good. Renee, any other value that you see accreditation?
Yes, I feel like this is a great way for the specialty pharmacies to differentiate themselves and also to commit to the excellence in service that they provide and that they are going to provide for their future clients.
Very good. Stacey, what does it really mean for patients, providers, and payers?
Well, I think it's an important baseline for quality, as we mentioned previously, but I think the problem really comes where there's a lot of overlap between the various accrediting bodies. We have Joint Commission, we have ACHC, we have URAC, we have CPPA, and there's a lot of overlap in those standards where the concern is really the focus shifts from providing quality patient care, which is what accreditation is designed to provide standards around, to maintaining all of the policies and procedures that are required to meet all of the accreditation. So you're putting time, effort, resources, money into actually meeting all of the various paperwork requirements of the accreditations rather than focused on patient and quality care like you're intended to be doing. So I think that becomes increasingly burdensome as we have additional players in the accreditation space.
Good. Nick, can you explain what a pharmacy goes through when they become, or they're trying to become URAC accredited?
So it's really an intense process, and URAC does, or actually, I'm sure all the accrediting bodies do a wonderful job in taking a look at the policy and procedures of a company in all aspects, from HR all the way down to disaster planning. But where I think the importance and really the biggest value is in the clinical programs. URAC probably does, in my opinion, the best job here, where they're actually looking to make sure that the standards and the data points and the collection and the processes are standardized. So now you have a standard, accountable, and reportable way to report and to make sure that the similar things are being kind of drawn there. Let me go back there.
So it's just that you really, they're looking for uniformity in the services and specialties.
Yes, it's a way for them to allow uniform, consistent monitoring of your programs.
Very good, thank you. Any other comments on URAC?
Sure, I think one of the greatest things that URAC specifically brought to at least our organization was reinforcement of putting together the quality committees and ongoing quality checks, quality improvement programs that specifically touch patient care. So that's been key.